Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with septicaemia laboratory diagnosis. When we talk about septicaemia, it is, in layman term, blood poisoning, where you experience serious calamity. The patient is really down, and you find so many organs damaging, even up to you find shock. There are so many causes of blood poisoning, which ordinarily would be taken by the layman as chemical poisoning and what have you. But when we are talking of septicemia, we are talking of bacteremia, that is where it is a situation of bacteria causing the problem, of viruses, viremia, or fungi, fungemia, or parasitemia. So these are names that are terminologies in microbiology, in medical field, that you really want to now identify through the laboratory assistance. So that's where the laboratory diagnosis really comes in. So that when you are able to identify the causative agent, you are now eminently qualified to really eradicate it, because even with the causative agent, you'll be able to know the antibiogram or the drug that will effectively remove it or cure the disease. It is not only organisms, microbes, that cause this problem. There could be inflammation of the problem. That is when you talk about toxins and other issues, reactions in the blood. These are all that I will be looking into in the slide section. So if you like my presentation, as usual, press the like button, subscribe, and more information will surely come your way. The outline: objective introduction, lab diagnosis and prevention, or also called conclusion. The objective: to create more awareness of the various problems that immunocompromised neonates and aged people are prone to, which necessitates the need for prevention or fortification of the blood integrity. Now to the introduction. Septicemia is life-threatening, which clear understanding and demystification is credited to the German bacteriologist Dr. Robert Koch. We've heard of the Koch postulates, who discovered the bacteria that cause anthrax, septicemia, tuberculosis, and cholera, and his methods enabled others to identify other causative agents till date. The term septicemia, or blood poisoning, or sepsis, refer to the microorganisms or their toxins in the blood. For ease of understanding, the circulatory system is well fortified against any infection, because any invading foreign body is subjected to serious scrutiny and possibly attacked by the immune system, which comprises of the passive or natural, the adaptive, and the active immune response. It is only when one is immunocompromised, like somebody who has HIV, the HIV virus attacks the immune system itself, the one that creates that cellular immunity. The aged are, not so efficient at attacking or keeping good health, or neonates that are just still virgins, that the integrity of the circulatory system could be easily violated and develop into sepsis. Sepsis is life-threatening. It happens when your immune system overreacts to an infection. Severe sepsis is when sepsis causes organs to malfunction. This is usually because of the low blood pressure, a result of inflammation throughout your body. That is when the immune response itself becomes a problem. Septic shock, on the other hand, is the last stage of sepsis and is defined by extremely low blood pressure despite lot of intravenous fluid. From all that had been said, it is clear that septicemia or sepsis usually start as infection. When you talk of bacteria, bacteremia, viruses, viremia, fungi, fungemia, parasite, protozoa like malaria and the rest, parasitemia. Before proceeding on check to sepsis, septic shock is the last stage of sepsis and is defined by extremely low blood pressure despite lot of intravenous fluid. This is for emphasis sake, so that when you realize that stage, you really know. According to the Center for Disease Control, the sepsis-related death rate among adults aged 65 and over was 277.4% in 1,000 from the studies. Death rate for those aged 85 and older were 5 times higher than adults aged 65 to 84, making it a very, very serious and often fatal condition for the age group that comprises the largest percentage of nursing home residents. So you can understand that even children, though when you talk of nursing home, there is that element of less care and the food and nutrients not being seriously standard. Yeah, laboratory diagnosis. For bacteremia, do bacterial identification in blood culture bottles and antimicrobial sensitivity thereafter in order not to abuse drug to reduce antimicrobial resistance spread. For fungemia, the same thing, blood cultures that will encourage the growth of fungi. Viremia, PCR can also be done for bacteria and fungi. That amplifies and identifies the viruses in the blood. For parasitemia, microscopy of the plasmodium, malaria, toxoplasma, and all these other protozoan organisms, parasites. For septic shock, the CBC is done to complete blood count, platelet count, serum creatinine, bilirubin, serum lactase. The lactase is also indicative when it's high that there is highest lactate has the highest mortality rate according to OL findings. You are now talking of inflammatory reaction, C-reactive protein, and the urinalysis is also very useful. If the blood is poisoned, then you suspect. Finally, we talk about conclusion, prevention and conclusion. Without much ado, for prevention, avoid all the risk factors. Check them up. 2 of the risk factors are the neonates, when the young baby, and the aged, which can't be avoided because if you have to live, you must be born, and you have to live to old age. But there are recommendations that help boost neonates' immunity, like exclusively breastfeeding the baby and water sanitation hygiene. That would help give the baby a very standard environment. The aged, as seen in the CDC report earlier shown, 65 years to 84 and above, shown are more prone to sepsis or septic shock. So it is advisable that their lifestyle should be streamlined to cope with their present realities, and they should take more antioxidants to slow down aging. When we are now talking of the immunocompromised, you are talking of people with HIV, diabetes, and the rest. So the older you go, the more exposed you are to these various problems. The communicable diseases as well as non-communicable. It depends on your lifestyle. So it is advisable for those age group to avoid things, smoking especially, and too much alcohol intake. Then more of less the lifestyle, the promiscuity, and so should be totally reduced, because the bacteria or virus or anything that penetrates into the blood will find easy access to even cause damages. The meningitis that you have, it pass straight to the brain and cause meningitis and all the other complications. So it is not advisable for the aged especially to live a risky life. the risk has been taken when if you like my presentations and all my videos, you can check more. Enjoy them all. Acquire more knowledge on health matters. Knowledge is power. Just subscribe by clicking the subscription button and also click the like button. It's a way of encouraging more quality production from me.